Right. Hi, everyone. We're here to talk to you today about using evidence and analytical frameworks to answer questions at the intersection of healthcare and climate change. My name is Mike Wilson. I'm the Scientific Director at the McMaster Health Forum and an Associate Professor in the Department of Health Evidence and Impact. And I'm joined today also with my colleague, Carrie.
Hi everyone, my name is Carrie Waddell. I'm the Senior Scientific Lead of Evidence Support at the McMaster Health Forum.
Okay, so a bit of an overview of what we want to go through in this session with you today. We're going to start with giving a high-level understanding of what a policy is and its use in climate and health. And then we're going to turn to a high-level overview of key analytical frameworks that focus on three areas. The first is on systems analysis, which is what we mean by analyzing the governance, financial, and delivery arrangements that determine whether the right program services and products get to those who need them. The second is what we call policy analysis, which is about using evidence to clarify a problem and its causes, framing options to address the problem, identifying implementation considerations, as well as finding and using evidence in doing so. And then the last is about political analysis, and this is focused on understanding factors that may affect government agenda setting and decision-making processes. And then in the last part of the session, we want to talk about evidence support systems and why they're important for when windows of opportunities arise. And we'll give a link to here government agenda setting and to informing decision making as one input among many considerations that need to be taken into account when policy decisions are made. And we're going to try and highlight some specific examples of how we've done this through some ultra-rapid evidence syntheses and living evidence syntheses that draw on or contribute to what we call the global evidence architecture. So to start off, I'm going to turn it to Carrie to talk about what is a policy.
Great. So a policy is a course of action that's adapted or pursued by a government or organization. There's four broad domains of health policy. We often talk about three types of health system arrangements. We talk about governance arrangements, which is who can make what types of decisions, financial arrangements around how money flows, and delivery arrangements, so how care is organized within the health system. And finally, we also talk about the different programs, services, and technologies that exist within health systems. We also looked at four different types of policy instruments, and these are instruments that speak to how policies are implemented. So they could be implemented through legal instruments. These are things like acts and regulation, often what our mind first comes to when we think about policies. Economic instruments, things like taxes, public expenditure, public ownership. You can have voluntary instruments, so things that are standards and guidelines. They could also be formalized networks or less formalized networks. And finally, we can talk about information and education. In terms of there are a range of different examples of where policies can be developed. They can be developed at assemblies of international organizations. Think about, for instance, the UN General Assembly, parliaments or legislatures, within cabinet, offices of the Prime Minister or President or Premier or Governor, office of the Minister or Secretary of Health or the Minister for Environment or the Minister for Climate Change, the Ministry of Health or Ministry of Environment and Climate Change, regulatory colleges, and other bodies that are acting with delegated authority. Examples of where to look for policies and different descriptions of them can be things like government listings of acts and regulations, government and ministry websites, so things like their web pages in different media releases or reports that are issued, and then websites of other bodies that are acting with delegated authorities, for instance, the International Panel on Climate Change. A few examples of some policies that exist at the intersection of climate and health. The first, in terms of international agreements, we can think about things like the Paris Agreement, which you may have heard of. This is legally binding international treaty whereby signatories are responsible for meeting their nationally determined contributions based on plans laid out in national climate action plans. We can also think about our federal government climate policies, so things like the federal carbon pricing policy, where there's a requirement that provinces and territories have a pricing system in place for industrial emitters that meet national standards. We can also things like the Health Adapt strategy, and this is a financial or economic incentive for the development, testing, and carrying out of local and regional climate change and health adaptation plans. There are also things like organizational policies, and these are much more voluntary policies. So for instance, the Canadian Medical Association has a policy on environmental sustainable health systems in Canada. Choosing Wisely Canada has a number of climate-conscious recommendations that hospitals can choose to adopt. And the Canadian Coalition for Green Healthcare has a Green Hospital Scorecard, which can be used to examine how well a hospital is meeting different requirements for their green healthcare.
Okay, thanks, Carrie. So with that, we're going to turn now to thinking about some frameworks that you could turn to for system policy and political analysis. In a lot of our work, we like to try and use some grounding analytical frameworks to guide our approach, so we take as much of a systematic and transparent approach to our work as possible. So to start with, I'll talk a little bit about system analysis, and first from a health system perspective. So this is a kind of a high-level overview of our taxonomy of health system arrangements. So in other words, how health systems are designed to get program services and drugs to people who need them. We've given the links here on our slides to where the more detailed taxonomy is located, as well as to our searchable database for evidence syntheses about health systems. So the way we've used this framework is to categorize every single evidence synthesis in the world according to governance, financial, and delivery arrangements for health systems using this detailed taxonomy. So at the governance side of things, as Carrie said, this is about who gets to make what types of decisions. This could be things about policy decisions or organizational decisions, about commercial authority, or about professional authority. So for example, who oversees different regulatory colleges or oversees the rules and regulations for different professionals within the system. It can also be about how we engage from a governance perspective in relation to engaging consumers and stakeholders in decision making. For financial arrangements, again, as Carrie was mentioning, this is how money flows through the system. And we use some very precise language here for different types of money flows. The first is for how we finance system, and this is about ways in which we raise revenue to pay for things within the system. The second is funding organizations, and this is for paying out that money to the organizations that operate within the system. And then the third one is paying out money directly to providers, so remunerating providers like physicians. And then the last two categories are for purchasing products and services. So for example, specific co-payment schemes or different ways of paying for prescription drugs within a system. And the last one is sometimes we also incentivize consumers to do things in a particular way within a system. The last bucket of categories relates to delivery arrangements, and this is more about how we organize ourselves to get the right care to those who need it. We talk about this in relation to 4 broad areas. The first is how care is designed to meet consumers' needs. Sometimes we're talking about this in relation to getting timely access to care or services, also culturally appropriate care or services, or getting the right care pathways or packages of care in place for people who need it. The second is by whom care is provided. So these are the different types of providers and how they operate. So for example, do we have a nurse providing care or a physician? Do we operate within multidisciplinary teams? Those kinds of arrangements that involve the people involved in providing the care. And then the third is where are we providing care? So those sites or settings of where care is optimally provided, for example. And lastly, with what supports is care provided? So things like electronic health records or medical records and other information and communication technology. In addition to this, when we think about social systems, which is where things like climate change would rest, we use the same kind of taxonomy of governance, financial, and delivery arrangements, but in our database that we link to at the bottom here called Social Systems Evidence, we also categorize all the evidence syntheses in the world about social systems using 20 program and service areas that are listed here on this slide. So it can include any number of things like children and youth services, citizenship, climate action, or environmental conservation, food safety and security, other governance services, or housing and infrastructure and natural resources. So it's a much broader category, but reflective of the complex nature of social systems are much broader, of course, than health systems. So for the second area, we want to move to ways of thinking about policy analysis, or more broadly, how do we think through a policy cycle and the types of decisions that need to be made and the role of evidence in each of those different stages. So on the left side of this slide, we have the policy cycle labeled 1 through 4, with the first stage being understanding a problem and its causes. And then once we do that, we can move in the policy cycle to selecting an option for addressing that problem once we have a good understanding of what it is. Thirdly, once we've selected an option, you then move to thinking about implementation considerations, and once we've begun implementation, it becomes time for monitoring and evaluating impacts. But the important thing that we're trying to convey on this slide is that depending on the stage in the policy cycle that you're in, the form of evidence that is most helpful for your policy analysis changes. And I'll go into a little bit in the next slide, but as you can see at the for one form of evidence like data analytics, it's very helpful for understanding a problem and how big that problem is. It's not really helpful for understanding options to address a problem, because here we're looking for things like evaluations or ideally evidence syntheses of evaluations. It's not as helpful for identifying implementation considerations, where behavioral and implementation research and qualitative studies are most helpful. But it does become much more helpful again at the last stage for monitoring and implementation, evaluating impacts, where it can be coupled with things like evaluation and qualitative studies, again, to best understand whether we're reaching those who need it. And then all this is in the context of trying to always harness global evidence in the form of evidence syntheses of any of these forms of evidence to inform the policy cycle. Because with an evidence synthesis, you have more confidence that all of the studies in a particular area have been captured and synthesized in one space, and it prevents the challenges of trying to figure out which study is best to focus on, whereas an evidence synthesis gives you everything in one spot. And you can complement those things with things like jurisdictional scans of, or what we just called systems analysis, of what different jurisdictions are doing in a particular area to give insights into how it's been operationalized in different contexts. So now moving to using the same 4 stages of the policy cycle, so problem and its causes, selecting an option, identifying implementation considerations, and monitoring and evaluating impacts, you can then ask questions in each of those stages that then map onto different forms of evidence that can be used. So for clarifying a problem, we're thinking about how big is the problem. We can use here data analytics to best understand that, things like indicators. You can also make comparisons. So is the problem getting worse or bigger here than elsewhere? And again, we can use data analytics, but use things like administrative database studies to get a good sense of how big it is or whether it's getting worse over time. And then lastly, it's about framing. How do different people describe or experience a problem and its causes? And here, qualitative evidence is the most helpful, so using interviews or focus groups. Now, the questions are very different when you turn to selecting a policy option. And if you're weighing many different options, you're going to want to ask for each of those, what are its benefits? What could go wrong with it, or the harms? What are its costs or cost effectiveness? So for example, does one option get more for the same investment? What kinds of adaptations might need to be made that will let it work as well here as it did elsewhere? And what are some important stakeholders' views and experiences? Now, as you can imagine with these questions, different forms of evidence help answer those questions. For the first 2, benefits and harms, evaluations are the most helpful. But for benefits, you're looking to things like effectiveness studies, like maybe randomized control trials if they exist, whereas harms are best captured in things like observational studies. For costs, we can look to technology assessments or cost effectiveness evaluations. And then the last 2 are best served by more qualitative forms of evidence, but with adaptations, it might be studies like process evaluations, whereas stakeholders' views and experiences are best captured through interviews and focus groups that understand what's important to citizens, for example. When you turn to implementation considerations, it's thinking about, first, what are the barriers and facilitators that might need to be considered to make a policy happen for people within the system. So here we can look to some interviews or focus groups to better understand those barriers or facilitators, and then combine that with some behavioral or implementation research to think about the benefits, harms, cost effectiveness, or other implementation strategies. And then lastly, is the chosen option reaching those who can benefit from it? And is the chosen option achieving desired impacts at a sufficient scale? Those are the key things you want to know for monitoring and evaluation. And here, as I mentioned in the last slide, we're turning to things like data analytics and evaluations to help us understand those questions over time. Now, that's the snapshot of policy analysis. So that's 2 types of analyses covered, systems analysis and policy analysis. And the last is political analysis and thinking about how things are prioritized and how decisions are made. The first framework I want to walk through at a high level is about government agenda setting. And so John Kingdon wrote a book about government agenda setting and provides a really helpful and also very simple framework for understanding why governments prioritize some issues over others. And he talks about two types of agendas. The first is what he calls the governmental agenda, and this is the list of issues that are getting attention. This is the much longer list, anything the government might be paying attention to. And then he distinguishes that from the subset of the governmental agenda, which is the decision agenda. And that's a much smaller list of issues that are up for active decision at any given time. Now, in the framework, it talks about those issues that are getting attention at a particular time. It's usually because of one of two things. Either there's a compelling problem that's emerged, or there's some sort of conducive politics that is driving attention to a given issue. And then it only becomes up for active decision at a given time because it's when people within government have then agreed that it's a significant problem, there are one or more viable solutions in place, and the politics are conducive to action. So he talks about these three streams that we come to on this slide. So in the framework, Kingdon talks about three different streams that drive attention to issues on a government's agenda. And within each of those three streams, Kingdon offers three different factors that can contribute to each. So for identifying whether something is a compelling problem or fostering agreement that it's a significant problem to get a government to pay attention to it is often driven by things like focusing events. So these are sad or compelling stories that are often high-profile news items that essentially require government decision makers to pay attention to it to some extent at least. This can then be combined with things like changes in an indicator. So if you can imagine a spike in a new infectious disease or something that grabs the government's attention and requires them to be on top of that issue. And then the third piece is about feedback about a program from the operation of current programs. So in other words, from existing programs that are in place, sometimes problems are identified, so it's not working well, it's not reaching the people as intended to, that highlights areas where things need to be done differently. Going to the right side of this table, Kingdon talks about politics and what makes politics conducive for either paying attention or eventually acting on something are swings in national mood, or in other words, that the public views something so strongly that it warrants the government also having to pay attention to it and potentially acting on it. And similarly, but in relation to interest groups, is changes in the balance of organized forces, where persuasive interest groups can raise attention to particular issues and get the government's attention to at least pay attention to it. And the other are what he calls events within government. So things like new government budgets or speeches from the throne or an election that means that there are certain things that are set up and the government is paying attention to it as a result from those cyclical pieces within a government. And then the last piece in place for a government to then act on something are policies. So Kingdon talks about this idea of diffusion of ideas in a policy area, or natural selection, where lots of policy ideas are floating around and are recombined and put in different forms to address current issues. Think of it as an evolutionary perspective of policymaking, where ideas are reformed and reformulated to be able to address current issues. He also talks about feedback here again, but in the context of identifying from the operation of existing policies things that could be done differently to offer a solution for the problems that have emerged. And then the third is communication and persuasion, where he talks about how some visible participants can say this is the best policy that needs to be used and use their persuasive power to bring that up as a viable policy to at least be paid attention to. Now, in the second row of this table, Kingdon offers additional threes in each of those streams of problems, policies, and politics. For a problem, he talks about that a condition or something gets defined as a problem for government action by trying to compare it to current conditions to where they want to be. So where their agenda is or their goals that they've set for themselves, comparing our performance with that of other jurisdictions or provinces, for example. You often find provinces comparing to each other to see how they're doing, or framing it to try and think of the problem from the perspective of many different people who are either working within or affected by the system. And then for policies, he talks about those that survive to the state of serious consideration are ones that are technically feasible so that we can do. They fit with our values for what are deemed acceptable for different policies and are also acceptable given our constraints like budget workability and political support or opposition. And then lastly, political agenda items that meet the criteria in this last column at the bottom right are more likely to rise to prominence on the agenda if they are kind of fitting with the national mood or public support, get interest group support, and are fitting the orientation of whatever the governing party is at the time. So that's the agenda setting. In other words, what gets attention and what's up for active decision, but not specifying what policy ends up being chosen. And the second and last framework I'll cover for you, it helps with that policy choice, understanding why some options are chosen over others. And we offer this framework as a way of understanding those political factors that drive those choices. And we talk about this in relation to what's called the 3I plus E framework. The 3 I's relate to institutions, interests, and ideas, with institutions being about the rules of the game within which our policy decisions are made. So things like government structures, policy legacies, and policy networks. Interest is about societal interest groups and other such groups that can drive influence about why some policies are chosen over others. Ideas are things like evidence about what is, and sometimes also our values that shape what policies are most likely to be acceptable. And then sometimes external factors like judicial decisions or other such things can be an important impetus to change that kind of disrupt that policy or political equilibrium that means that some things are put on the table that wouldn't otherwise be there. So when we're talking about institutional factors that affect policy choice, the bottom line is that a policy is going to be more likely to be developed at any particular time if the rules of the game with our political sphere allow it to pass easily. And we think about that in relation to three things. The first is government structures. So very simple questions. Does the governing party support it? If not, it's going to be an uphill battle to get it taken up as a potentially policy option. Does it face what we call veto points, which means that can a decision made in one part of government be overturned by another arm? In Canada, that doesn't often happen unless you're in a minority government situation like we are at the federal level, where the Liberals need support of another governing party to pass any legislation. Whereas in countries like the US, where there is separation of powers between different arms of government, there are many opportunities for veto points. And then the other piece around government structures that's important is whether it involves one level of the federation or multiple levels. So any time where you have to have agreement between a national and a subnational level of government, it makes the decision much harder because you have to reach consensus in agreement on what should be done, and that's very difficult and can often devolve into things like finger pointing between different levels of government. When we think about past policies, so the things that we've already decided on, those can have an influence on future decisions as well. We often talk about this in relation to what we call policy legacies. Sometimes past policies shape the resources and incentives we have in a system that makes certain ways of doing things much easier than other ways. So for example, in healthcare, we pay for things through publicly, but using private organizations. We do not deliver things publicly, which means that if a policy option required public operation of different programs, it would be much harder for us than administering an insurance program. And then sometimes it also gives us ways of thinking about the system that shapes what is more or less acceptable to government elites, as well as to interest groups and the public. And then the last is about how institutions interact with the interest groups within the system, and sometimes there are groups that might have more privileged access to authority and decision-making structures than others, and therefore have much more influence over decision-making, over the policies that are chosen. Now the key questions to ask are, in this part of it, is just, does the governing party support it? Do they face any veto points? Does it involve one level of the federation where the party governs? And if not, if it's only one level, then it's much easier. Have any sort of past policies led to some supportive resources or incentives for choosing a particular policy option over another? And for policy networks, is the government involved in a policy network that requires both the government and the interest group to sign off on a decision? If so, that's much harder because it requires much more negotiation versus just with groups who are in an advocacy role rather than policy participation role. Now, when we think about the second I, interests, we're talking about societal interest groups like citizen groups. It could be broadly taxpayer groups, anybody paying into our public system of whatever we're talking about. Or it could be more patient or issue-based groups, so groups living with a particular medical condition or that form around a specific societal issue. It could be professional groups like physician associations, or it could be non-governmental organizations like the International Institute for Sustainable Development or International Panel on Climate Change. Or they could be industry groups like the Canadian Association for Petroleum Producers. All have a unique interest and stake in the system and serve to win or lose given the introduction of any different type of policy option, and they may advocate very strongly or maybe not so much depending on whether and how that policy option affects them. There's some other interests that we need to consider here too, sometimes very strongly positioned elected officials that can be very vocal and shape the policy discourse, other civil servants who may speak up, sometimes researchers become very vocal advocates as well, or anyone who we could broadly kind of term a policy entrepreneur, that type of person who can have a lot of sway in the political sphere and influence government decision makers, perhaps other interest groups, and also shape the types of ideas that are floated and seriously considered. Now, when we're talking about kind of interest groups, we also need to think about how much power they have. Do they have enough resources like money or in-kind benefits like people to go out and volunteer and get the word out and help cue voters for specific issues or specific kinds of things they think the system should be doing. These things can take the form of political lobbying or making donations to political campaigns. There are also some indirect ways in which groups can influence the policy discourse, like having some anticipated reactions for thinking about some policies might be floated and taking a proactive stance on trying to shape public views and discourse about it. Sometimes we also need to think about, are groups going to be really persuasive or effective or not? Sometimes not all groups are going to coalesce around the same issue, and that can mean that they're not going to be as significant a player as they could be. Sometimes those groups are also not as cohesive as they could be, and it can affect their mobilization towards one issue or another. Now, the key questions you're going to ask here if you're thinking about some sort of a political analysis about a policy option just boil down to asking yourself, which societal groups is a particular policy option going to affect? Then asking, are any of those groups have some sort of privileged access to authority, so they have more sway over decision making that's going to happen about one policy or another? And then of those groups that you're thinking about, who wins and who loses? So who serves to get a lot and who serves to lose as a result of a new policy being implemented? That'll give you a sense of who's going to mobilize and maybe who won't, and also by how much. So if they serve to win by a lot, some groups are probably going to put a lot of money into mobilizing. If they serve to lose a lot, similarly likely to mobilize and try and advocate against a particular policy. The last part of that, the I's, is ideas. This is very straightforward, two broad categories. One is about knowledge or beliefs about what is. Here we're talking about things like research evidence, so going back to that earlier framework I talked about with policy analysis, about the different forms of evidence that can inform different policy options. So again, the benefits, harms, costs, what adaptations can be made, stakeholders' views and experiences. But then there are other types of information, like looking at what other jurisdictions are doing. We often hear governments saying, well, I know what we're doing here in Ontario or British Columbia. I want to know what all the provinces are doing. That will tell you what groups are doing. It doesn't necessarily tell you if it's the best way of doing it or not, and you need evidence to be able to do that. But then there's also what we call tacit knowledge, and those are the people who are working within the systems and have that unique view on how things work and can give a sense of whether or not particular policy options are likely to be more or less acceptable and whether they're likely to achieve what they're designed to based on the local conditions or context in which the policy be implemented. The other part of ideas is about values or mass opinion about what ought to be. These are things like should statements. It could be from elite opinion, like government elites or interest groups expressing values for what policies should be achieving within our system. Could be things like informed mass opinion, so essentially taking polls of people but after they've been given information about a given policy, or just straight up mass opinion where you just ask people for their reactions on the spot without information provided in advance. Bottom line, it boils down to any policy is more likely to be developed if ideas are aligned with it, either because things like different forms of evidence or ideas about what is support it, or values about mass opinion or what ought to be are aligned with it. Now, as I mentioned, the last part that can affect policy choice are what we call external factors. And these are really disruptions to the political equilibrium that mean that some things all of a sudden emerge as being on the table when they might not have otherwise been. A great example that everyone's gone through is the COVID-19 pandemic. Major external event, lots of different policies that may not have been on the table otherwise, that all of a sudden had to be considered and considered very rapidly. But sometimes it can be a political change, like election of a new government, that changes ways of thinking about policies and what's acceptable and what's not. Major economic changes like a recession, which means we have to do more with less money. Technological changes that make certain things possible, like AI-driven solutions that weren't possible even a few years ago. Court decisions, releases of a major report, emergence of a new disease like COVID-19, or intense media coverage, a major announcement by an international organization that shapes the policy thinking of countries around the world, or also initiatives by major international donors that can shape the policy landscape for what is acceptable in terms of what's going to receive funding. But bottom line, the policy is more likely to be developed if external factors act as a trigger to action. Now, we have here a link to our handout. We provide all of this kind of in a 2-page snapshot, 1 page about agenda setting and 1 page about the 3I+E framework, give you a very quick rundown of the factors to consider in each, the predictions of each model, and then interventions that you can consider if you would, for example, like to try and advocate for a particular policy to get seriously considered in the policy discourse. So with that, I'm going to turn to Carrie now about some insights related to using evidence.
Okay, so the last section that we want to go through is a little bit about how we actually use evidence in both the agenda setting and decision-making stage. So recall here that there's different forms of evidence that can be used to inform stages of the policy process. And so Mike went through that piece that was the circle with all the different stages of the policy process and all the different forms of evidence that can be best used to inform them. You'll also recall the approach to addressing pressing policy questions and the role that research evidence has in creating ideas. As a little bit of background to this, Mike and I spend most of our days, apart from Mike being a professor, is responding to government questions regarding pressing evidence needs in health and social systems. So that often looks like them coming to us with particular questions and us responding in very rapid timeframes with the best available evidence that we can provide to answer those questions. So there's a little bit of 2 frameworks that I want to run through with you to think about how we can use evidence in the decision-making and policy process. So the first is distinguishing what we call an evidence support system from 2 other systems that you may be a little bit more familiar with. 2 other systems, the first is the research system. So this is really, when we think about primary research, what that looks like. So often a investigator-driven is very interested in a question, develops a research study, and pursues that research study over a period of months and years to answer that given question. The performance of the research system is often measured by things like peer-reviewed grants and publications in journals. We also think about the innovation system. So this is either products or intellectual property that may be developed and put out into the public. The performance of this is often measured by things like patents or licensing revenue. But both the research system and the innovation system have shortfalls when you're looking to rapidly inform decisions or decisions that are up on the decision agenda or that to inform governmental policymaking. We currently spend a huge amount of money in Canada on both the research system and the innovation system, but much less and in very small chunks on the evidence support system. When we speak about the evidence support system, we speak about a system that can rapidly tell us what we already know, so all the evidence that we already have generated over many, many years and in many different contexts, to deliver that to advisory and decision-making processes and to learning and improvement platforms. Advisory and decision-making processes in this case could be ministries of health or ministers of health, high-level organizations, secretariats, for instance, and learning and improvement platforms are often the kind of continuous learning processes that we speak about in health and climate systems. The performance of an evidence support system is ideally measured about whether the needs of a decision maker, advisors, or implementations were actually met by evidence. So is the questions that they have, are the questions they have being answered by the evidence available? When we think about the components of an evidence support system, we think about three pieces, one of which has sort of a side piece to it. So the first is the structures and processes on the evidence demand side. So this is really those who are requesting evidence, so the need or demand for evidence, often a government policymaker, how they incorporate evidence into their decision-making processes and into learning and improvement, how they build and sustain a culture of evidence. So within the organization, are there requirements or processes in place for how they may use evidence? And finally, how they strengthen capacity for evidence use internally. In that middle section in yellow, we talk about kind of a prioritization mechanism and a coordination mechanism. An evidence demand prioritization mechanism looks like the elicitation of questions and horizon scanning. So is there somebody within a government department, for instance, that's responsible for coordinating the requests that come in for evidence? So if many people sitting in the Ministry of Health, for instance, or the Ministry of Environment and Climate Change have a number of different kind of pressing health questions, all of which may be on the governmental agenda, they may be looking for evidence on each of those questions. That would then go to the evidence supply coordination mechanism, whereby somebody on either a research team or somewhere else that could be external to the government body or within the government body itself can rapidly produce and pull on the existing evidence that they have to answer that question. They pull on there the last piece of component 3, so the supply of evidence. So these are timely demand-driven evidence support units that can rapidly tell us what we already know about in each of one of the following 8 sources of evidence. And you'll recognize those 8 sources of evidence from that wheel that Mike had showed previously that talks about, in a given question, what we might answer. So for instance, if you have a policymaker who's asking a question about what are the health impacts of wildfires this year, that could come down through the evidence prioritization mechanism. Somebody on the supply side would say, oh, we can answer that question, and they would rapidly get together data analytics, for instance, which would tell us how bad indicators like smoke inhalation might be this year compared to previous years, but they could also pull on things like qualitative insights from people who are being affected by wildfires to speak a little bit about how it's impacting their health. That last piece also connects into what we call the global evidence architecture. Mike alluded to this when he spoke about evidence syntheses. So global evidence architecture are things that are global public goods like evidence syntheses and living evidence syntheses that get produced once and used many, many times. Evidence syntheses are compilations of studies that provide us with the big picture of what many, many studies say on a given question. So rather than having domestically in Canada, for instance, to answer every single question every time it comes in, we can pull on evidence syntheses that tell us overall everything that we know rather than going back and producing a new study from the beginning. Next slide. This piece speaks about the different components of the global evidence architecture, and this is something that's sort of emerging a little bit more as conversations around evidence support develop following the COVID-19 pandemic. So we speak about 3 different elements here. The first is infrastructure, and this infrastructure is technological infrastructure that's available for people who are sitting in different countries to be able to pull on and access and rapidly access the data that's coming out of evidence syntheses. So these are things that allow, for instance, user engagement and capacity sharing, platforms for data sharing and reusing, and responsible innovations in tools and methods. This middle piece is a suite of LES, there stands for Living Evidence Syntheses. So these are suites of living evidence syntheses on advancing the Sustainable Development Goals that are being developed around the world by a range of different groups and kept up to date so that they can be produced once and again used frequently by research groups within countries to pull on those and rapidly provide evidence support to governments. The final is that last piece that I spoke about, the actionable insights served up in different ways for different decision makers, sectors, regions, and languages. Last but not least, we thought we'd leave you with a few examples of the evidence support system in action and how it's been used to address issues at the intersection of climate and health that have been on governmental agendas. So these are all examples of questions that have come to us at the McMaster Health Forum that we've worked on relatively recently to produce timely demand-driven evidence support. So some of the topics that we've covered are health and social impacts of evacuations and interventions to mitigate their effects, the effectiveness of masks to reduce exposure and health impacts of wildfire smoke, heat, and pollutants, achieving net zero emissions in health systems, and adaptation interventions in built environments that reduce the risk of human health due to climate change. There's also a number of global evidence, there's also examples of global evidence architecture investments that have been made recently, including a machine learning evidence review on scientific literature on climate change. So that allows us to rapidly understand how all of the different literature in the world maps onto the different dimensions of climate change. And finally, a $10 million investment that's recently been made by one of the largest charities in the world, the Wellcome Trust, funding for living evidence syntheses that's focused on climate change and health. I think that's it from us.
Yep, so we hope you find this presentation about policy, different frameworks that can be used to think about policy, whether it's about how systems work, how to analyze policies, or the political considerations about them, and these last few slides that are more practically about how to support evidence use in decision making and some of these exciting global evidence architecture investments that Carrie noted. So thank you very much.
Thanks.